President and the Director of the Macquarie University, Bangkok, and also the President of the Thai Association of the Thai Aesthetic Physician. We call it ATAP.
วันนี้ดูจะได้เชียงใหม่
And also the committee, scientific committee of the IMCAS World, Asia, Paris, and also in Bangkok. This is my disclosure. So what is the biostimulator? It is a substance or treatment that stimulates the body natural biological processes, typically to produce a new collagen and down to the elastin, and also improve the skin quality, restore the facial volume over the time. This is my last talk in London last June, and we still also the debate about different kinds of biostimulator that is available in the market or in Thailand. As we know, the biostimulator originally comes from thread. So we solubilize or rinse the thread into the fluid form. We have the PDO at the beginning, the polydiphenol, and also we have the polylactic acid, PLLA, and also PCL. The other combination, the new coming out, is also some of the low molecular weight HA or CAHA, the calcium hydroxyapatite. This is quite a conclusive slide for me. We have many systems of chemical so far, PRA. However, the last 6 months, we go into another steps. We combine the HA inside the product. Before 2 years ago, when the first of the biostimulator registered in Thailand, it's a sole only chemical, no other mixture. For example, the one is the PLLA from I mentioned it from Scafra. Is the only the PLA plus the CMC. CMC is not, it's just a solvent. And then we have the PLA, we have CAHA, PM, PLA, and also low hydroxide. It's also all the chemical products that come solid. But last 6 months, we combine the HA inside. The CAHA alone is the radius. Now we combine HA into harmonica. So it's quite a comparative product so far. We have the Nubia that combine the CAHA, PET, and HA inside. We have the PN, also PN plus. They mix the HA inside the same syringe as the PN. Then we have the PLLA plus HA inside the name called Sticol. And also some of the PRA plus PN. And lastly, dioxane profilo also produce low and high HA. And you can see the degree of the improvement in each indication for the fine wrinkles, the smoothness, pore enlargement, oiliness, pigment by hexameter, elasticity by photometer, and telangiectasia, the redness of the face. You can see the variety of the improvement of each of the product, which is not the same, and also the mechanism of the response also different. However, one thing that they cannot improve so far is the redness, the blood vessel. They cannot improve the telangiectasia of the face. So this is somehow the quite of my own experience, observation from many products that has come into the market. So I will show you some example. This one is a PLLA. You know the structure of PLA. We mentioned the name, but I mentioned all the comparator names that we can understand quite easily. So that is a PLA plus CMC. And now we have the new, the still core, which is a PLLA plus HA mixing together. And the application we can use for almost all the face, including neck and hand. However, under the eye might be different thinking, because the thinner skin, the PRA is not suitable because the molecule is quite big. So I'm using this for the neck area. And you know, the PRA is a microsphere with a very flaky that can stimulate our response. However, the newer sphere is more round and more porous, not so high, not so aggressive stimulation. And we can combine with the CMC inside as a solvent and make it the hydrophilic form. And then we mix the HA inside this PLLA. So you see the micelles and also the HA circulating around in the fluid. And the HA is the non-clothing. Remember, non-clothing or minimally clothing. You cannot use the high clothing inside. If you want to volumize or contour the face, then going to the high clothing or high viscosity HA. And this is the response. You can see that there are quite a numbers of the response on the histology, and biotin degradation is up to even a year and a half. For the interval and the treatment, we require normally for the 3 treatments every 1 month, count about, and then we assess another 12 or every 6 to 12 months upon your patient's response and also side effects and complications. So this is how I inject with this product, the PLLA plus HA. So we use for the neck, somehow I tried one in entry point, difficult. Now I have 3 entry point. It's more convenient for us. Then open with the 21G needle and use the 25 or even 22. For this one, I'm using the 23G cannula. And going, you can see that we go along the line and also tangentially down the line. And of course, we have to stay the cannula on the platysma, on the muscle, important. If you go too deep or puncture into the muscle, number 1, you can notice it might be the bleeding, hematoma, and also very discomfort. But if you go under the muscle, it's loose, it's easy to advance the cannula. So that is the wrong plane already. So on the correct plane, it is difficult. You see, when I go inside, you have to create a kind of a pocket, and then going. This is fast forward for speed up. But normally we have to go not too aggressive, not too fast. So on the second point of entry, then you can go to another 1 or 2 lines. And then we go to the 3rd line, and then spreading the product. For the biostimulator, one thing is, after the injection, you have to mold or spread the product quite well. Otherwise, it will form the granuloma or the granulation tissues too much because of the response.
This is the thread.
And again, this is on the other side. You can see that, entry point. This is a local cytokine injection, and then open with a 23G, and this is 23 gauge cannula. Again, go in. So somehow there's a resistance. What is the resistance in on the platysma muscle? If you remember, there's a platysma cutaneous retaining ligament. So that hold our face in a neck in shape. So that is a tiny, small resistance we call platysma cutaneous ligament that you have to dissect or go through. So one important point is go slowly in the correct plane for the neck area. So you have to pinch or a little subcision, like a subdermally, into the plane of the simulation above the muscles. So again, you have to go, see, when you go slowly pushing, thrust, push, then you can go pass through the ligament. But before, sometimes you can push in a little of the volume before going to the neck area. So somehow, neck is one of the tricky areas. The neck is more or like suborbital area, under the eye area, or even for the forehead line, because the dermis is very thin. It's thin, and the response is look like the under eye, so easy to scarring. We have many cases with the scar after the fractional, even the laser treatment, very thin, but the response is not as our expectation. Sometimes we use the filler with the cross-link, then you can see the bump 6 months after, not immediate. That is some tricky or the bizarre response of the neck. But somehow for the biostimulator, it's quite forgiving. So, but again, we have to inject slowly, homogeneous, more on the side of the neck area. So this is before and after. You can see minimally the response, not completely, no. You cannot like a eraser very quick. On the face, also you can increase a little of the volume, because after the mixture of the istico is containing 16 ml. 16. So one vial, you can do neck, face, 8 on one side. So this case, we put 4 on the face, 4 on the neck, and 4 on the. So altogether is 16 ml, 1/6. So see the nasolabial fold include, for example, this the contour. It's also to see the jaw. So this is the volume going up, so you can see the bump. This is also the face look more natural. PDLLA also plus HA inside, not just the PLLA alone. There are 3 or 4 products so far in the market. The PLA plus EMC alone is aesthetic. For this, PLA plus HA is the to look, and it's a particles which is not too freaky, not too stimulus. So in the middle between the PLA and going to the like a PN or the CAHA. So I'm going fast. Of course, we can use these 2 products as different concentration or the amount of the PLA inside. The Jubilook is about 3 or 5 times more PLA than the Lanisna. So we have to mix well with the shaker. The level of the injection is what important. Before we recommend to inject into the dermis, because the blast and the stimulation is in the dermis. However, if you get into the dermis, it's quite painful, number 1. And number 2, you can feel the bump. especially the PDLA, these two products we have to go in a bit. So we can go into the intradermal, like PM or the PM polynucleotide. We can inject it into the intradermal. And then CAHA, maybe smaller molecules, we can go subdermally. And for the PDLLA, PLLA, or this big chemical, we have to go into the superficial subcutaneous layers. So this is a before and after with the one vial. This is one vial of the Ladisna. For the all the patients, in this case we combine. Actually, we combine the thread. We inject with the Ladisna one vial first, and then use another 2 threads on each side of the face. One vial. So see, the biostimulator, somehow the response is not volumization. It is kind of for the fatty face. Biostimulator can create minimally fibrosis and then contract. So make the face look a bit tighter, not overfilled or look like a balloon in the fillers injection. So the face mostly look tighter and soft, if you feel that. Now I'm going to also we can inject with the other of the face area, with the thigh, with the arm. For the thigh, I use the Ladisna 3 vial plus the HA. Again, by the cannula, cannula number 22, 5 centimeter long, and it goes scattered superficial into the superficial subcute. The subcute layer, not subdermal, a bit deeper. And then you go like a band shape around the whole area. We can enter maybe 2 or 3 points of entry, depending on your convenience, your hand skill. So just make it scatteringly around the area that we want to treat. So this is kind of a little bit of the conclusion of the chemical product that we can use for the face, except we have the loop alcohol that can be used under eye, forehead, or the face. However, for the CAHA or the PRA on the under eye, lip area and the forehead cannot be used. Now to the complications again. We have seen certain case with the neck area like this. See, if you go to superficial, you can see the scar or the response. It is your stimulation, or you create the scar inside by this chemical stimulation. The latest one from Brazil, 2024, the cosmetic complications of the collagen biostimulator in Brazil, about 55 cases, and we break it down into the PRA about half, CAHA 23.6%, and the PRAS is 20%, PCL polypropylene 7.3%, and mostly it's a nodule. You see, the 90% is a nodule on the face with the palm, on the surface, visually, or after your patient press or going. The treatment is saline. We have to use a saline flush in order to stabilize the product. Otherwise, we cannot use the other like a Hyles. Hyles they use, but the Hyles in this, not the hyaluronic acid, because somehow a little bit, but for the PRA or the PCL, hyaluronic can act as an anti-inflammatory so far. So we use that a bit, 25%, and other than that, we can inject with the steroid or the other solution. So there are certain studies so far for the complication coming out. And lastly, CAHA. CAHA also report 1925, 2,800 cases, with the 173 about 3%. Also the nodule, inflammatory swelling, and resistant edema. So that is also from the CARHA can have the complications as well. Actually, I have some more of the laser treatment, but I will go back on the go further because the software and also some of the matrix injection laser treatment that can be, so we can combine the other energy-based devices to enhance the beauty of the biostimulator. However, you have to start with the energy-based device, anything that creates the heat into the skin, make it first, and then continue with all the biostimulator that like. This is my course that I would like to advertise for these 3 months is the recent advances in aesthetic dermatology. We have already done myself, I mean my team, for over 15 years. We started 2010 for this course every 3 months, every Saturday, 9 to 17. And also in January in Paris, and as a committee